meeting. It's a while since we've had one, and as we're all very aware, the world has shifted quite dramatically since we've last connected. So we'll use the opportunity of the meeting today and tomorrow to explore some of the key issues that we are being faced with. And I'm going to hand over to Gabriele, who's the co-chair of the GHC SAG, to take us through the start of the meeting and then on to some of the sessions. So Gabriele, over to you.
Thanks, Linda. And then hello, everyone. Welcome to this Global Cluster Annual Partner Meeting. I'm Gabriele, as Linda said, co-chair of the SAG of the Global Cluster. So before indeed sharing with you day one, day two at a glance the program, let me just go through this housekeeping information rule. Please share your name, affiliation, position. Also when, for example, you want to intervene, just share your name, affiliation, and position. The presentation will be recorded. In general, during the presentation, please mute yourself. If you have a question or comments, feel free to write them in the chat. We will try to address them. For each session, there will be a dedicated person, a chair, moderating the discussion. If you want to intervene with question or comments directly, thanks to raise your hand, and the mic will be given to you for your intervention after the presentation is finished. So we can move to the next slide. Veronique, thanks. So as we said, the Global Cluster Annual Partner Meeting these 2 days will be held online. And yeah, it's coming at a critical juncture, critical time during this building up of the Humanitarian Reset process launched by Tom Fletcher, the Emergency Relief Coordinator, amidst this funding crisis. So we will, in the first part of today, we will talk, we will indeed, our discussion presentation will revolve around the Humanitarian Reset with the Humanitarian Coordination Reform presented by Altaf Mouzani from WHO, followed by Cluster Simplification and Transition presented by Ted Chaban from UNICEF. And finally, for this first part of the session, implication of the reset on frontline coordination and leadership by Albert Philippe Bourguer from ICVA. Then the second part of this of today will be with the second session on area-based coordination, the so-called ABC. Then we will have Marina Skuric-Prodanovic from OCHA telling us more about the key, let's say, principle stemming out from the GCC G paper, so the Global Cluster Coordination Group paper. And then we will have as well Dr. Mukesh Kumar Prajapati from the Cluster Coordination of South Sudan, telling us more about indeed the experience in South Sudan of ABC, what works well and not. For day two, we go a bit faster here. Thanks, Veronique. We will have indeed the first part of the day with focusing on the experience of Myanmar earthquake response at the beginning of this 2025, with Dr. Sithura from Community Partner International explaining the role of local actors. And we will then, the second part of the day two, we will spend much time and we will look as well forward for your precious input on the Global Cluster Formative Evaluation with a presentation of the process, of the finding, of the conclusion by Riccardo Polastro from WHO, and a recommendation with a prioritization exercise presented and chaired by Linda of the Global Cluster, indeed. So without further ado, further note, I think I can move to Kelly, who will chair indeed the first session. We'll introduce the different speakers. We have 90 minutes for this presentation, and this section. After this first session, we will move directly, without any coffee break, in the interest of time, to the second section on area-based coordination chaired by James. Thanks, Kelly, over to you.
Absolutely. Thanks, Gabriele. So many of you guys have heard about the many things probably about the Humanitarian Reset. We're really excited to hear from our three speakers in this session this morning. This week, the principals met, and so we're excited for Altaf to give us the most up-to-date kind of overview of what that's going to look like for us as implementers on the ground. So it's my pleasure to introduce Mr. Altaf Musani. He's the director of the Humanitarian Disaster Management team at WHO. So over to you, Altaf.
Thank you so much, Kelly, and it's good to see everyone virtually. I just wanted to get confirmation. Did we get Ted online, Linda?
Yes, I saw.
Altaf,
Yes,
I'm here too. Hi, everybody.
Great. It's good to see you, Ted. So I will default to Ted on some of the issues on the principles because they've just met 2 days ago, and he obviously has some fresh intel as well. So what I thought I would do, this slide in front of you, hopefully everybody's seen it. If we can just get a reaction of a thumbs up that you've seen it, because that's what's driving this conversation. I'll make my points in 3 buckets really quickly. One, in terms of processes that have been underway and timelines, so everyone understands conversations that are happening at so many different levels. 2, in terms of impact to agencies and organizations. And then, of course, number 3, where are we going from here? I thought it is important that, one, and Ted knows this best, we could probably unpack each one of those points and probably consume quite a substantial part of the day just understanding what each one of the 10 points plans are. There are papers written about each one of the points. There are debates that are underway. Our colleagues from ICFA can easily tell you, in terms of localization, what does that mean for Myanmar? What does it mean for Lebanon? So there's the good news is there's a tremendous amount of engagement, communication, and coordination happening on the reset plan. But I wanted us to take a step backwards and just say, what's driving conversations right now? In essence, there's a lot, and it's unfortunate that we find ourselves, within the last 10 days of a potentially new front and armed conflict, which alludes to the new and evolving emerging vulnerability that we constantly refer to. So number one, there are 3 things that are driving major conversations, as you said, Kelly. One is the humanitarian reset, but it's not in isolation. The humanitarian reset in concert or in similar conversations with the UN80 initiative is what is driving change. And again, I think the principals, as well as the deputies, correct me if I'm wrong, Ted, as well as the emergency directors group, all the various ancillary organs of the IAC have been saying that the reset cannot happen in isolation without having very clear conversations with the UN80. Now, the UN80 is something that we could, again, unpack. There are a lot of papers out there. This is very much related to the Secretariat and the United Nations systems at large, but we recognize that driving force is having a deep impact on the development, political, and security side of work, and how it will impact the humanitarian reset program in its own right. We do have representation both from the agencies as well as Tom on the UN80, and so it's important that we put that in perspective. So number 1 is the humanitarian reset. Number 2 is the UN80. And then number 3 is a lot of prioritization activities and exercises that are going within their own institutions. And so when you look at the World Health Organization, we're just getting some additional conversations.
Please, everyone, to mute yourself, because otherwise there will be some echo. Thanks.
Thank you, Gabriele. So in terms of prioritization exercises, my own institution, as well as several of yours, are looking at the liquidity of funding, both in 25 and 26, trying to accelerate planning milestones and trying to understand what does it mean in terms of staff and activities. My own institution, as the CLA, I can just give you a quick example. That Dr. Tedros has decided to really focus on headquarters as kind of a lead in terms of where we want to go. And again, we could probably talk for hours in terms of where we are. Very briefly, we have now consolidated various divisions at HQ level. There's been a reduction in the workforce in terms of leadership, but it will continue to go throughout the summer and as a run up to 2026 in terms of functions and activities at HQ. The idea is that it will then filtrate downwards in terms of our regional office, and Dr. Tedros has been very clear, as well as Mike, that we want to protect the space of our country operations. So our leadership, our cluster coordinators, our emergency officers, our outposted offices within countries should remain protected for the time being, and we continue to look for resources. But however, that entire prioritization exercise that is having a deep impact on the institution, as it is with many of your own institutions. So in our conversations at the field level, colleagues may know that recently I joined OCHA on an interagency mission to Lebanon and Syria. And the big pushback from a lot of our partners is it's very difficult to participate in these conversations when we're trying to safeguard our own operations. So again, how do we balance these three different initiatives, include ourselves and our thoughts into these conversations, but equally important, safeguard operations that we know are having a deep impact on lives and livelihoods. So I thought it's important to understand that there are these three major buckets driving change in the world right now. My second point is updates associated with a few of these. Number one, most recently, the hyper-prioritized Global Humanitarian Overview has been released. We all know very well that the level of need continues to accelerate. The last time I checked, it was well over 300 million people in need in the world for 2025. But the hyper-prioritized GHO is looking at how we can target about 114 million. Now, this gets difficult because everybody wants to latch on to different numbers, different settings, different context, whereby we try and really prioritize the most vulnerability. And this is part of the challenge. So this is the message number two. As we look at numbers, as we try and safeguard partners, as we try and safeguard our own operations, what does that mean in terms of the delivery of humanitarian assistance? And I think I'd look forward to hearing from Ted. Although we're very process oriented, which is good, we need to have a deeper conversation of what does humanitarian action look like in 2026. Sorry, I think we're still getting some feedback.
Maybe can you just ask everybody to mute if you're not speaking, please? Thanks.
Thanks, Veronique. And so the conversation of coupled with all right. That conversation, coupled with extensive violations of international humanitarian law and human rights law, is what is deeply worrying. When we look within health, we've recorded more than 8,600 violations throughout 17 settings. This has had a tremendous impact on patients and providers, but on the health system at large. And that, if we take a live example from Iran, we know that there are 3 hospitals that have already been hit in the context of Iran. That, coupled with the shrinking of the humanitarian space, the targeting of aid workers, the targeting of healthcare workers, the targeting of basic social services, is what's really driving vulnerability and the ability, capacity of humanitarians, local and national and international, to be able to provide assistance. And that is extremely complicated because the safeguards that member states and state actors often have signed up to are now in question. And so there are separate conversations that are being driven by ICRC and a number of member states in terms of how do we look at the Geneva Conventions, international humanitarian law, and make sure that everybody that has signed up to this continues to adhere to this. Now, unfortunately, we're seeing a massive erosion, as I've said, and Gaza and what's happening in the West Bank is just a mirror image of what's happening in South Sudan and Sudan. And it's not just the attacks on the systems, it's the reemergence and the danger of privatization, securitization, politicization of assistance. And we've seen this already in three contexts that I mentioned: OPT, South Sudan, and Sudan, where the onset of militia or new state actors, non-state actors that don't necessarily adhere to the humanitarian principles or best practice, and want to go out and deliver assistance under a securitized agenda. So this is secondly equally alarming. And so when we look at that second bucket in terms of conversations, again, in terms of our agencies, here we have done a reduction in terms of technical capacity. And I often question, with quote unquote the culling of a lot of expertise, where is that expertise going? We're not the only agency, and again, all my colleagues online can attest to the fact that major UN agencies are downsizing, reshuffling, reorganizing, and putting more strength into country operations. But what is that having in terms of impact on back function, in terms of consolidating, coordinating conversations that need to be had globally as well as regionally? Now, we are seeing the emergence of continued regional entities providing support. This is the AU, the ASEAN, the SADCs of this world, of recognizing that they could play obviously a more important role on piecing together common themes, whether it's drought, whether it's security-related issues, or common border-related issues. And the deep worry is, as we move forward in time, none of us have a crystal ball, but Mike Ryan often talks about the 3 C's: climate, contagion, and conflict. And the combination of the 3 happening in many settings. Cholera continues to plague us globally. We were hoping that within 3 years, joint work between ourselves and UNICEF, both on WASH and health, to try and quell some of those outbreaks. And there's a lot that has been done in a number of countries, but yet cholera continues to spread in a number of these settings, both that are security and non-security related, again, indicating the erosion of our development work as well. So that's number 2. Number 3 is, where do we go from here? And I think this is part of the conversation that you'll be having over the next 24 to 48 hours. Again, I look forward to hearing from the other colleagues, particularly Ted. And this is a challenge, because with reduced workforce, reduced financing, reduced space, and reduced protection, how do we ensure the lives and livelihoods are being addressed and safeguarded? And this is the biggest challenge that we find ourselves into. Some of the quick solutions are buzzwords like localization, and this is critical. This is not new. Many of us as agencies have localization strategies. The Global Health Cluster and other clusters have put out, what does it mean to support local agendas? And there are some good examples. The work that's done in Lebanon, both prior to the ceasefire, during the ceasefire, and post-ceasefire, is indicative of the fact that localization works in that context. Now, that's had decades of support, and again, is very different from other settings that we've worked in. But we know that there are national and local civil society partners that are on the front line. And whether you use the Red Cross, Red Crescent Society, whether it's civil society in large, again, another case in point that comes to mind is Myanmar, and I know that we'll be talking about the earthquake response. So our challenge going forward is, how do we understand where localization is happening? It's not this light switch moment whereby we're just going to invest our resources into local partners and have them take on that responsibility. I think that's reckless and irresponsible from our side. And so how do we balance that technical relationship, that operational relationship, and most importantly, the financial relationship going forward? And so some of these are some of the observations in terms of next steps. Obviously, localization is critical. When we look at the availability of financing going forward, a lot of conversations on the better utility of the SURF, country-based and common pool funds. What does that mean for agencies? What does it mean for local partners? Talk of a financing facility to look at humanitarian assistance. All this to say that, there has to be a shift forward. Now, on a positive note, and I didn't want to end on a negative note, clearly the role of the Federation and the Red Cross and Red Crescent societies gives us hope, meaning that a lot of us have seen the work of SARC in different stages. People have seen the work of the Palestinian Red Crescent Society. Again, huge institutional experience, huge trust currency of the people that we aim to serve. And again, how do we invest in the various settings, in the technical capacity and the operational and financial support that we provide through that modality? Now, we can't all front load into the Red Cross, Red Crescent societies all that technical expertise. And so when we look at the preparedness levels for the next pandemic, how do we identify risk? How do we manage that risk? I think these are all the challenges. Also, on another positive note, within the last 30 days, colleagues have seen the pandemic accord has obviously met the muster, with the exception of what we call the pathogen agreement. Biologicals is called the PABs, is something that is an annex to the pandemic agreement. That will be critical because it helps us understand how we will be sharing internally, externally, with private sector, with pharmaceuticals, with ourselves, the next pathogen of concern. That being said, obviously a lot of questions around multilateralism being challenged, and that signaled the fact that the world did unite on the future pandemic is something that we need to build towards. So again, in summary, 3 major areas: the reset, the UN80, and our own prioritization exercise driving change. 2, as an institution, trying to safeguard as best as we can our operations, looking at tomorrow's risk, whether it's armed conflict, climate change, and or a contagion. And then 3, what are some of the solutions going forward, as pointed out in this 10-point plan, whether it's better advocacy, whether it's better localization, whether it's better financing. The danger is we're trying to define a remit of work. And the question is, how do we look at humanitarian assistance 2.0? We've had several milestone moments in the last couple decades. I'll end with the fact that there's some deep concern that there is this light switch moment whereby we turn on and off those needs. Those needs will always be persistent, whether the UN system or the humanitarian system and or is present in a country. So our advocacy to those we serve and to those who finance this is going to be very critical. And hence the consolidation of who is in need, who we target will be critical. I know that a lot of the country teams are working through this and has helped to influence the hyper-prioritized GHO. But we need to be very cognizant of the fact that just because the humanitarian system has run out of funding, it doesn't mean those humanitarian needs go away. And then lastly, heavy engagement with political and development sectors to be able to try and come closer into places like DRC and pick up not only the tab, but that engagement. And there are places that are happening. A good example of the international financing institutions using IDA funding in DRC, in Sudan, in South Sudan, in Yemen, is indicative of the fact that there is development and or recovery financing, which can be channeled locally through UN agencies, through partners, to be able to do that capacity building, long-term system strengthening work. And it's not a one-size-fits-all. We have a lot of good examples, as I pointed out, but I sense that this is going to be shifting the dial a bit in terms of putting more pressure on the development side of the institutions. Now, as a dual mandated agency, it gets equally complicated for ourselves. The good news is we talk about the system and the providers to support people. So it's not a paradigm shift. It is just making sure that the system continues to maintain its resilience. But as I pointed out, when we do a lot of horizon scanning, the 3 C's are what keeps us awake at night. So that's it from my side, Kelly. I'm sure there's 1,000 questions, but again, I'm humbled the fact that Ted is online and he can certainly give you a quick readout of some of the principles work. Over.
Absolutely. Thank you so much, Altaf. So just as a reminder, we'll have our 3 speakers for this session, and then have a definite period of time where you guys can all ask questions about how this will affect our working and implementation. So feel free to pop a question in the chat. Veronique and myself are monitoring that, and or save it and speak up at the end. We'd love to hear you guys off your mics. So it's my pleasure to introduce Mr. Ted Shaban. He is the Deputy Executive Director at UNICEF, as you guys know, and also the IASC OPAG co-chair. And so, Ted, we're really excited to hear your updates. Thanks for joining us today.
Thank you very much for having me. Thanks to Linda and Gabriele, and thanks to you, Kelly. And great to hear from Altaf, who did he just hit all the right notes. So, in some ways, I'm not sure what else to add. I also should say I'll be leaving a bit early, so I'll listen to what I can and answer, any questions or comments come my way until I need to go. But it's a pleasure to be with the health cluster colleague here today. Let me start with some of the points that Altaf made and kind of build on them. Firstly, and I think this was emphasized at the principals meeting yesterday, there's that strong emphasis on really prioritizing humanitarian action where it's most needed on the most vulnerable. And that means both working in fewer contexts, but also, and this is going to be more complex, specifically when we're dealing with chronic or complex emergencies, working for a shorter duration of time and having a transition to other forms of support and cooperation. And what I try to emphasize in this discussion, I don't think it's coming out strongly enough as of yet, is the importance not only of linking better between what humanitarian actors do and what the development systems can cover, or indeed in situation of mixed migration across borders, what actors looking at mixed migrations will do. The first thing that I think we need to be looking at much more clearly is the role of host government, and how to really start the discussion with what is the responsibility and accountability of host government, what can be done. There will be exceptions, whether it's Gaza or Sudan under current circumstances, but from Ethiopia to Democratic Republic of Congo to Haiti, I think the first responsibility that we have is to see what exists already, what kind of systems are in place, and how can we build on these. And I fear that all too often as humanitarians, both in the way we plan and the way we organize ourselves, and this has been specifically true in terms of clusters, but generally for the community, it's almost like we're in a vacuum, and we come in and like our contribution is going to be the solution to what exists, whereas what it needs to be is complementary to what's on the ground. And some of the language and direction of travel that is being emphasized in the Humanitarian Reset, as Altaf has pointed out, builds on that. But I would say to go even further. So the way it builds on it is that it speaks about the importance of localization and pooled funding. And the vast majority of pool funding going towards local and national actors, all of which are things that we're, I think, all strongly supportive of. The question then becomes, and my entreaty will be to include government where it's possible as part of the definition of local and national actors, and to make sure that the funding that we consider going to local and national actors, again, where it's possible, builds on existing systems, reinforces those systems, and makes the response sustainable from either the acute peak we're in or from the get-go when it's a rapid onset emergency. You'll be discussing Myanmar later in your agenda. Turning from that overall kind of, if you will, transition from Altaf's comments to mine, let me focus now specifically on one of the 10 steps that you have in front of you, which is the simplification of the cluster system. This was a task that my colleague Gabriella Weitzman from Save the Children and I were asked to take on by the ERC as OPAG co-chairs. And we did so with the following appreciation. Firstly, is that of all the humanitarian coordination systems that exist, the humanitarian or of all the coordination systems that exist, the humanitarian coordination system is probably the best defined. And part of the reason that is because clusters are one of the ways that we can have a predictable and accountable action. And we wanted to make sure that whatever we did in terms of simplification recognized also the positive elements of what's been done over the last 15 years. And clusters is a key element of what's positive with the humanitarian coordination system. So ours was not to kind of tear down and substitute so much as to reform, simplify, and strengthen. And in this regard, there's a number of headlines that I'd like to share here. Firstly, was an emphasis on context and indicating that HCs and HCTs, and you often hear this language about empowered HCs. And our position on empowered HCs is we back empowered HCs with the following understanding: that HCs work closely with HCTs, not in isolation, that humanitarians are part of the selection process of the RCHC, that HCs have the skills and the backing to be able to be successful HCs. With that in mind, we support empowered HCs and empowered HCTs, and so they should be able, based on context, to decide which clusters to activate, which clusters to deactivate, and what's needed locally, if you will. That's the first point. The second point was we looked at the clusters overall and try to see how to simplify the architecture. And there was both a recommendation, which the principals have broadly supported, the minutes will be coming out, to move from 15 management points to 8 when you count that there was a number of areas of responsibility under protection that are now going to be part of one protection cluster. And then recommendations around grouping together a number of issues around shelter, grouping together telecoms and logistics, and all of those reforms lead to going from 15 to 8 cluster point. I should say that there was a couple of discussions, should WASH be part of shelter? Should health and nutrition come together? And there were counter arguments to that. In the case of health and nutrition, which I think is closest to your work, there was an emphasis on nutrition being, if you will, the intersect between health and food security, but also on nutrition needing to look at a number of sectors or being multi-sectoral, specifically in terms of its work on prevention. So, that was part of the rationale for not at this stage making those steps. But, the ERC and the community will continue to look at these issues and make those and have those discussions. So that's the second point. The third was to see how much more we could share IM and other resources, and see how much could be simplified in this regard. And then the fourth was to look at country level, A, co-location of the clusters, B, a reporting line, a dotted reporting line from the cluster lead to the 8C. So the idea where it's possible, if the 8C is in a location with a common UN office or common off-premise, to have the cluster leads be in that common premise next to each other. So B is a dotted line to the 8C. C is to have within the cluster community a person that focused specifically on gender. And the ERC is concerned that we continue to have a strong gender lens on the work we do, as are we. And the idea would be to ask women-led organizations to recommend someone who could sit there. D is, to the extent possible and where possible, have co-leadership of the clusters at national level with local and national actors. And then two final points, obviously linked to government and the government coordination structures as much as possible. And then an emphasis at subnational level on area-based coordination. And I see that this is on your agenda as the next agenda item. So there was a very healthy discussion about how does ABCs, and our paper, if you get to take a look at it, kind of makes a recommendation about how national, provincial, district, and local all fit each other. And when we're saying area-based, we're talking district and local to an extent. And again, the discussion has been, how do you get community voices into the process? How can we be multi-sectoral in how we work and take those into account? And this is absolutely critical. At the same time, there's a recognition that if we're going to have scale and impact, we need to work with ministries and systems that tend to be sectoral. So again, what we came up with, if you will, is something that tries to bring both together: an area-based approach subnationally with a sector-based approach supported by clusters nationally, and how to find a communication back and forth between the two. So those are the broad lines of what we worked on. There's also information in the simplification we went through in terms of resourcing, like I said, how to share IM resources, rely as much as possible on each other, and references to some of what needs to be done on inter cluster basis. let me stop there in the interest of time, and glad to be part of the discussion until I have to leave. But let me finish where I started, which is a final series of recommendations was around activation and deactivation. So I mentioned at the onset that we were given a fair bit of, or suggesting strong latitude for HCs and ACTs to discuss and decide which clusters are activated and deactivated. But we've also recommended that the EDG in their annual meeting do a review of all of the humanitarian settings where clusters exist and question if clusters are still needed there. We do not want to be in a situation where for 25 years clusters are, whether it's Ethiopia or DRC or elsewhere, are the default mode for coordination. And as much as possible, we want to be in a situation where clusters can still provide a service, but in some ways hand over to sector coordination or some other instrument to bring the community together, hopefully in a way that's sustainable, while recognizing that there will always be situations where that's not possible. But the idea, again, is to get in and get out of situations as quickly as possible and as nimble a way as possible. Thank you, Kelly, and back to you.
Thank you so much. Well, let's get to Philip, Mr. Albert Philip Berger. He is head of policy and practice at ICVA, which is the International Council for Voluntary Agencies. They are an IASC member. And for those of you guys that don't know, ICVA is a global network of non-governmental organizations whose mission is to make humanitarian action more principled and effective by working collectively and independently to influence policy and practice. So they do a lot of direct implementation as well as advocacy. Albert Philip, I'd love to welcome you to the conversation. Thank you.
Thank you very much for having me. So thank you for having me. I'm going to take the discussion in a slightly different direction, perhaps a bit more general, and discussing a little bit what we see among our members in terms of thinking about the reset as a whole, especially when it comes to the coordination architecture. I will come to the clusters at the end, but I think first a little bit more generally on the whole process. First, and I apologize for striking a bit of a darker tone here, but I think at the same time within ICVA, we feel that the reset is also a chance perhaps to talk a little bit honestly about some of the issues we see with the coordination systems. I think it's important to remember where NGOs come from before the reset process started. And alas, I think that was first a position of lack of trust. Maybe some of you remember, but last summer we were going to have a discussion on trust. Alas, we were not able to hold it, but we were very much looking forward to it. The main issues that NGOs have with the system as it stands today is simply that it does not answer their needs. It's extremely difficult for NGOs to be part of the decision-making process. They feel there is a lack of accountability, that when things don't work for them, they don't necessarily have a lot of recourse. And I want to emphasize that this is felt as being directly linked to issues of efficiency. If NGOs are the ones who deliver the bulk of the aid, any challenges that affect them are essentially challenges to the response itself. So there's a strong expectation that the system will try to react, work as a team to try to solve those challenges. This is not really happening today, and it's starting to have some real consequences. With the international NGOs, engagement in coordination systems is getting lower and lower. It's becoming extremely difficult to find qualified representatives to send in HCTs because people do not see the point. And perhaps more worrying, if you look at the national NGOs who were only a few years ago banging at the door to have a seat, they're expressing great frustration with every setting where they get to sit because, well, basically having a voice is not the fundamental metric. It's about being able to influence the decision and getting a solution to the problems that you are facing. Now, coming to the reset, this is coloring NGO expectations on what the reset would bring. Yes, it's an opportunity to redefine the system as a whole, make it more fit for purpose. Yes, it's still under duress. So, it implies cuts that are not felt as being like, it doesn't feel like we're cutting the fat. And on the contrary, we're cutting things that are essential. It's just we're trying to keep the most essential. However, there's also the expectation that the reset will bring a shift in the balance of power and improve the accountability. Now, right now, we don't feel that the reset discussions are quite where they should be. There's a number of reasons. First, it's a process. I think we were hoping, well, it's not that we were hoping, but the timeline was looking to be very short, and in practice, obviously, it's much more complex than that and will take longer than initially expected. Secondly, it's important to note that all the NGOs, all the agencies already had to take internal decisions, based on the funding cuts, which makes it very difficult to have an in-depth discussion. How do you rearrange the roles of the variant participants if they've already, got rid of some of the resources that they would need to fulfill those new roles? But one of the issues is that the discussions of the Humanitarian Reset are affected by the very issues that NGOs have with the system, those power dynamics. At the global level, national NGOs are mostly absent. They've been managing to get a few meetings here and there, but for the most part, there is no constant representation at the global level in every meeting for national NGOs. I know it is difficult to organize. It would probably need a network. Nevertheless, the reality is those discussions are happening mostly without them. And then at country level, yes, discussions are happening, but it's the same as ever. It's a negotiation to be at the table. And even if you manage to get a seat at the table, you might not be heard. And this is problematic because whenever we're talking about subnational structures or about clusters, this will impact NGOs the most. They are the ones who are in need of the technical support, and they are the ones who are going to be operational and need those subnational structures to fit their needs. So that's extremely problematic. A bit on a lighter tone. Clusters, generally speaking, have a better reputation than the rest of the system. They are more appreciated by NGOs, especially national NGOs, than the rest of the system. There are still some issues. Accountability is still difficult to obtain. I think there is some big questions with co-leadership, making sure that it is always pursued rather than something that has to be negotiated country by country, cluster by cluster. And the role of the co-leads is still in discussion. It's still a problem when we see countries where we have qualified staff that are being treated as secretaries. Nevertheless, all the research we've done show that especially national NGOs think that clusters are the main point of entry into the system, and a positive one, and for good reason. First, they are more inclusive. They are open to all operational actors in that particular sector. That's already great. And secondly, they fulfill some very basic needs: the technical support on one side, the information management that can guide operations on the second. However, we're talking now about removing all subnational clusters. And while everybody understands why, for national NGOs, that's a catastrophe, because most of them do not have a presence in the capital. That means they do not have a simple point of entry into the system anymore. They're going to lose that technical capacity that they value, and there's no real replacement. Now, what does the reset propose to replace this with? Well, replaces might not be the right choice of words because it's actually very vague, but basically it's ABCs. Let's just replace anything that's below the national level with ABCs, and you're going to have a discussion afterwards. It's going to be interesting to see exactly what that means. However, all the papers emphasize that those structures might be locally led and should respect whatever structures are already in place. That is great. However, a few questions there. First of all, somehow it jumps completely over international NGOs who seem to not exist in a post-reset world. They're not mentioned anywhere, despite the fact they would probably be, in many contexts, the best solution to provide some coordination at subnational level. Secondly, national NGOs do have capacity, but it's going to vary a lot from context to context. So if we're jumping straight to the locally led, it's going to be very difficult in some of the countries where we work in. But most of all, it's going to require a change in dynamics. If you're going to work with the already existing, let's imagine tomorrow you have an onset emergency, the system comes in and says, we're not going to replace what's on field level. Well, how you're going to work with them is going to have to be very different. For one thing, it's going to have to be a negotiation. A cluster cannot come in and tell an existing national structure, well, no, this is your reporting line. This is going to be your rhythm of reporting. This is the data we expect from you, because they're just going to say no. And I noticed in the cluster recommendation paper, it was said that ABCs, well, subnational structures need to fit in the clusters. I don't think that's a model that's going to work. It's going to have to be the other way around. The cluster is going to have to learn with the capacity that is already present. And it means some level of adaptation and some level of discussion. The last thing I will say is that the good news is that this is in line with a lot of the work that the NGOs have been doing. I've been talking about NGO disaffection with the system. It doesn't mean disaffection with coordination. And NGOs have been building coordination mechanism pretty much everywhere. We have NGO fora in every single country of crisis, national, international, in some cases mixed platforms where both national and international join hands together. They are in many countries offering services to their members, which might include simple working groups, and it can go much further, all the way to Nigeria, Northeast Syria, where you even have some sectorial coordination being offered by NGOs. So there is some knowledge there. Nevertheless, what is going to be required is support, is going to require technical support, is going to require training. Today, if you look at the job of a cluster lead, it's 2 jobs in one. You need to be technically savvy, you need to know your domain, but you also need to be a good coordinator. I would say my strongest recommendation, you need a 3rd job there. You need to be a teacher as well now, because you're going to need to work with structures who are going to need to know how to do this. And this needs to be worked on, because otherwise localization is literally just dumping responsibility if it doesn't come with that technical support. Thank you very much for having me.
Yeah, thank you so much, Albert, Philip, for just the dose of reality that you bring to, what it feels like to us as implementers receiving this process in many ways from Geneva. So I'd love to open it up with for questions. First, I think it may be great if Ted and Altaf could address kind of the key point of Philip Albert's conversation points about how will local actors and us as implementers be represented in these revised coordination structures. I know Ted, you had mentioned that being a priority, but will we have a voice in the decisions about resource prioritization and like footprint adjustments and those types of things moving forward?
Do you want us to come in now, Kelly?
Sure. I'm just trying to open it up with some questions.
Okay. Well, I mean, I think Albert has, some interesting point he has put on the table. Let me try to address a couple, and then also a couple points I actually forgot to raise, which I think are also going to be of interest to your membership. I mean, look, I think overall we're going to have to look at simplification. And one of the things we're also accepting is going to be a reality. And Albert kind of referred to this. We're all going to operate in a significantly resource-constrained environment. And I think, firstly, the superstructure, whatever exists outside of countries, is going to have to become more narrowly focused. There's going to be less, I think, on kind of norm setting and standards. I mean, I think capacity is an interesting point. I think we need to have a way to maintain capacity. But I know that certainly in UNICEF we're having to make some hard choices about the capacities that we can keep while maintaining a certain core around the clusters that where we have leadership responsibilities, and I suspect it's true for the health cluster and other clusters as well. Also, by the way, we're moving people from high cost location to lower cost location. So we're moving a lot of people out of New York and Geneva to lower cost location, because that's simply the reality of the financial envelopes we're going to be working with. So that's the first point. At country level, what we're also coming to terms with, it's going to mean certainly double hatting, if not triple hatting, as Albert has said. And again, that's just the reality of what we're going to be dealing with, certainly at subnational level. And, I want to come back to another point, which is, where he says that, where does no longer having clusters at subnational level leave actors who have seen clusters as a way into the system? And I find it interesting because, firstly, I appreciate that that's a positive element that he brings out in terms of the clusters. But second, because I think at least the notion is that area-based coordination will still bring those actors to the table. And I certainly, in the paper and the discussion with Gabriella and other constituents, felt that we needed to find that intersect between the clusters and area-based coordination at subnational level. So I think it's going to be important that in the operationalization of these ideas, that dynamic, if you will, at provincial level, not so much at district or local level, is addressed. In terms of resources, it's going to be important specifically for local and national actors that part of the allocation of resources does include support for local and national actors to be able to be part of the architecture if that's needed in different contexts. And again, hopefully something that's relatively limited in scale in terms of what's needed, but and very punctual. Lastly, let me take the opportunity of having the floor again to mention two further points. One of the things that we looked at, which is quite important, is how do we increase efficiency between the overall humanitarian coordination model and the refugee coordination model. I mean, that I think has also been a source of, at times, inefficiency when you've got two systems, say in Lebanon or Chad, that are not in sync. In an atmosphere of reduced resources, we can't continue to have that efficiency. So we made some recommendations in this regard. And again, the point on double hatting is another reality of reduced resources. And then I want to come back to the point that Albert made about INGOs. So firstly, INGOs are cluster leads in a number of clusters, and I think at global level that should continue to be emphasized. And leadership at country level doesn't always have to be a cookie cutter approach. For protection, for example, HCR has said they're happy to be the overall global lead. They don't need to be the lead in every single country. And I would say that's true for UNICEF. It should be true for all cluster leads. But I think his broader point has come up, including in the IASC principles meeting yesterday, which is the INGOs are saying where do we come out in the humanitarian reset? And to me, there is a critical technical and capacity building role that INGOs are going to be called to continue to play that needs to be emphasized in this whole reform process. I'll stop there and back to you, Kelly.
Thank you. I have another question for Altaf, and then actually it looks like we have some hands up. But Altaf, I was wondering if you could just address this question that has come up a few times about how we're defining life-saving in health and protecting, health interventions as a whole, and then the package of, not only those emergent needs, but the kind of the public health actions and the capacity building on the ground for resilience.
So thanks, Kelly. And I think these are really good questions. And, I kind of take note from what Ted has said every situation. So first of all, we as a system at large, and this is not criticism. For decades, we've been very process oriented, as Ted has pointed out, with the aim of looking at efficiencies. It's not to say that the UNGA resolution said, create more layers just to have conversations. The aim has always been target the most vulnerable, address it from a lens of efficiency and effectiveness. And I kind of want to be clear here is that we want to be careful is that we're not driving the conversation based on efficiency gains, right? We as a humanitarian community have constantly looked at aid diversion and reduction of duplication in order to ensure efficiency gains. And we've been very adaptable and amenable over the last 20, 30 years. The financing that is associated with the work we're doing is heavily spotlighted, so there has to be additional layers of oversight that are required. That's number one. Number two is that when we look at New York and Geneva, Ted sits in New York and we sit in Geneva, but there is no separation in that conversation. The aim has always been, how do we highlight and showcase the mass vulnerability that we're struggling with, and the danger is it becomes a numbers game. So we, as I pointed out, we had more than 305 million at the start of 2025. We're now targeting 114 million. When you look at the optics and try to understand the number between pin and targeting and reached, I think sometimes the narrative gets lost. These are people's lives that we're talking about. So there has to be a shift change and really humanizing, as Ted said, what are we talking about? And is this an acute onset event like an earthquake, which you'll be talking about, or a situation like Haiti and DRC, as Ted pointed out, where there's the chronicity and the multiple shocks that come to the system, whether it's disease, whether it's displacement, whether it's climate change. And I think this is where we as a system struggle with, because we're very good as agencies to address single line threats. I could take my own agency. When it comes to the work on Ebola, we have learned a tremendous amount of best practice to say that in tomorrow's Ebola outbreak, we know roles and responsibility of government. We know roles and responsibility of the health system. We know roles and responsibility of our partners such as UNICEF. And so those relationships have really merged. And I want to say this because as a humanitarian, and Ted agrees with me on this, we've done a lot of good. We've done a tremendous amount of life-saving work on a very short string budget, right? Our appeals have always been underfunded. Our sector appeals have always been underfunded. So there's been a tremendous amount of work, and we shouldn't now, just because there's a tremendous amount of resource constraint, everyone point fingers and saying it's not working. I agree that we need to, as Ted pointed out, really get granular and local. And I think, as Albert has said, it's not a one size fits all. And we're not just dumping the work on local partners and say, take over because we're moving out of the game. But I do think that the New York and Geneva-based institutions will be reducing not only footprint, but that layer of oversight. That's number one. Number two is that, as what Ted pointed out, where the gravitas will happen is with HCTs and HCs. And again, it's not a new initiative. It is reinforcing an existing structure whereby the interface with government is there, where the interface of bringing partnerships together is there. Now, how can you replicate an HCT at every layer and level? Context specific. We do it in Aden, we do it in Sana'a. We do it in Damascus, we do it in Aleppo. So I think a lot of those kind of structural changes will slowly readjust for the purpose that Ted outlined. If you look at Nigeria, a very different case in point, tremendous amount of resources nationally, tremendous amount of agreement and drive to see change. And the establishment of a Nigerian Humanitarian Trust Fund by the government is a positive signal to say that we recognize that financing is a critical factor, but how do we deal with these various different threats? And what is the role of the IAC is to make sure that those needs get amplified. But as Ted pointed out, and Albert, hopefully to a certain degree, we don't need to solve all those needs. We can't be everywhere. And we need to, one, make sure that our development, political, and security partners are coming along with us, because a lot of those problems of DRC and Afghanistan and Haiti are security and political related problems. And I think that is a bit of a shift change that we'll see. The last thing is on financing. I'm hoping, and we're pushing for this, is that, and again, it's not a magic bullet here, that a lot of the country-based common pool funds will be, and they talk about percentages, 50%, 100%, all go to frontline partners. Now, that's going to come at a cost of, as Ted pointed out, when you look at agencies, funds, and programs providing the material bandwidth, the WASH support and the health support for a cholera outbreak are vital when we talk about the establishment of diarrheal treatment centers. OCV is not, oral cholera vaccination is not something a local partner can just absorb. The ICG mechanism requires partnerships and oversight built in order to identify the most epidemiological threat at risk and the targeting of which populations get OCV. So again, all this is to say where those conversations will be had is at that country level with some oversight provided by back office, if you will, Geneva, New York. And I think to your point on Kelly, life-saving, this is where we struggle, right? Because 20 years ago, we were just putting Band-Aids over Band-Aids over Band-Aids. We were told strictly look at life-saving measures. So in essence, trauma support. Over time, we said, make inroads into durable solution, make inroads into capacity building, make inroads into resilience. And we keep changing the nomenclature, where now we're back at that, really just look at that life saving. And I think this is where we need to push back with our donor partners. This should be about people's needs in that context, and it's addressing a variety of threats and risks. It's not a single disease, and it's not a single health condition. We want people to get into the door of the health system. And once they're there, it's a collective responsibility that there's a range of services and a range of support. So in essence, we have a defined tool, which is the health system that must maintain resilience. And again, good examples. Ukraine's resilience to the health system is a reflection that the government has owned the system, expanded the system, put the system underground, above ground, in order to address a wide range of risks and threats, mental health, CBRN, as well as women who need to continue to deliver. Other cases and points, when you look at DRC and Somalia, those systems haven't matured enough because the investment in the system hasn't happened systematically over time. A third example, Afghanistan. 20 years of development assistance dropped maternal and child mortality in half. It was one of the highest rates of maternal mortality in the world for 20 years. But that 20-year investment in services, in support, in technical oversight dropped it in half. Now, as we have a regime change, the pressure is on humanitarians to say, maintain the system. So I think those conversations between our development partners, and that's why I start with the fact that UNAID, Humanitarian Reset, and our own prioritization exercises must have a common approach to not just these paradigms that we find ourselves, development, recovery, and humanitarian, but really bringing together, as Ted said, context-specific, and really trying to drive donor influence in a situation like Haiti. Haiti is an eyesore for that region. And the question is, what more do we need to invest in politically and security and development-wise to change that paradigm? There's always going to be humanitarian needs, residual and new, like we're seeing in Iran, where as humanitarians will have to engage. But I think, Albert, to your point, in terms of that pressure on local partners, that's going to continue to exist. We need to make sure the capacity and the financing follows that, so that the partners on the front line are able to be present. But I think it won't be a one-size-fits-all. It will be very context-specific. Again, Iran has a tremendous amount of capacity amongst the Iranian Red Crescent Society, but also amongst its own government structure. And I sense that in the places like Iran and Nigeria, where there is relatively good governance, the pressure is going to be on government and local societies to be able to say, ultimately, the responsibility and accountability to serve those people you govern is yours, not ours. We've leaned in heavily as humanitarians, and again, it's not a blanket statement, to try and solve some of these situations, and we've done good, but now this is this moment of reflection, and I think outside of process, which we're heavy on, we need to reflect, as you said, Kelly, what does humanitarian assistance look like in 2026 with reduced resources, reduced footprint, and reduced bandwidth? I mean, I want to be careful here is to say we can't even do the job in Gaza when we know we can, because we have a state actor preventing us in terms of having access and safe security. And on top of that, bringing in new partners, which will securitize, politicize, and militarize aid. So it's a very uncomfortable situation we're in right now. I think, as Ted pointed out, a lot of those conversations at HCT level need to be had. We have tremendous amount of process which can help define and articulate what that risk looks like. And then there's the collective on all of us to be able to say, is it Haiti? Is it Yemen? I think we should be a bit careful not to look at prioritized countries only, because the GHO looks at about 76 countries, whereas the work of the emergency directors looked at 43, where the presence of an HC is. Once you remove an HC hat, the RC, which is often dual-hatted, there's only one place that will have a single HC, I think, Ted, it'll be Myanmar. But other than that, everywhere there's an HC, there's an RC, and the RC has that responsibility through UNGA resolution to look at humanitarian needs. Will there be the big presence of OCHA? Probably not. But the agency funds and programs will be there in some form or fashion. So there's going to be tremendous pressure on places like TED and our institutions to be able to continue making sure that we have presence in these volatile countries, and we're able to provide the material and technical support as needed. And I think those are tough conversations ahead of us with donors. Thanks.
Appreciate that. Gabriele, you've had your hand up. Would you like to ask a question or a comment?
I think the first is Ricardo.
Thanks, Gabriele.
Yeah.
Ricardo, go ahead. Sorry.
Yeah, thank you. So, Ted, good to see you again, and congrats for your new role. We haven't seen each other since time. So, I've got a question here for the rest. We've got a contextual shift from multilateralism to unilateralism in a multiplicity of crises that you've described. Now, right now in the reset, the key determinant, and across the UN system, also at single agency level, is funding. What is good to see in the reset is that there is a learning component on one of the agendas, a synthesis out of the interagency humanitarian evaluations. However, in the funding, what we've seen is an exponential growth over the years until 2024, and then there's a drop. And the prospective drop for this year is a 40%, roughly, based on the report that ALNAP presented yesterday. Now, across the board, it seems that there's a chronic amnesia of the lessons learned. So my question is, beyond the funding incentives, what are the incentives, the real incentives for organizational change, and not just at individual agency, across the humanitarian system? Because the funding seems to help mushroom, expand the footprint, or diminish as a key determinant. We don't learn from all these, and I'm recalling evaluations done back 20 years, which point to these systemic issues that we are highlighting now in the reset. So over to you.
Ricardo, who would you like to answer your question or your comment?
I like the three speakers actually too.
Okay. Ted, would you like to go? Do you have any comments on that?
I think that what we're saying is that the funding crisis, it's an extremely painful reality. And I think Albert brought some of those elements out. But we also need to, certainly I can say, I think that's both the spirit of the Humanitarian Reset and of what we're trying to do at agency level in UNICEF, and arguably in UN80 as well, is how do we not just say, okay, we have a funding crisis, let's do exactly what we're doing, but with 30% less, but to actually be future focused in the reforms that we're looking at. And some of it is possible within a comfort level most people have, and some of it's going to require some more difficult discussions. And I think that's maybe what Ricardo was arriving at. And it's good to see you again, Ricardo. But just to say that among, I think what is more comfortable is things that we do in common or that we connect easier on. And then second, more difficult is areas where all of us need to focus more. And there was an implication of the earlier question to Altaf about what's considered life-saving in the health cluster. But, I'll give an example. I mean, how do WFP and UNICEF work better on management of severe acute malnutrition? And that requires each of us to make some hard choices. How do the INGOs and the UN agencies work better in a way that builds and supports national capacity, but also gets out of direct implementation or situations where a UN agency provides funding to an INGO, which provides funding to a national NGO, which provides funding to a CSO, and that we play roles where we all make hard choices about where our comparative advantage is. So I think the reform and the moment we're in is driven by financing, but it shouldn't be the only thing that drives us. I think there's been a need for reform already. We've become set in our ways in some fundamental fashion, and it's painful. And real people are affected. Jobs, people with children. I mean, I think every person in Haiti that works, and every national colleague who works in Haiti, whether a driver or national officer, has 30 to 40 people that depend on them. They lose their job. There's nothing else in the economy to fall back on. So it's real pain, real people. But we also need to find out, how do we come out in a better place than we have been on some of these issues. Thank you.
Kelly, you want me to come in with a couple of remarks?
Yes, I appreciate your bring your honesty to the conversation.
Honesty, enthusiasm, that's what I bring. Well, it's always a bit difficult when you speak in the name of a broad and diverse membership. So sometimes I have to be careful on what I say. First, I want to react to what Ted just said about it's important not to do the same but smaller. I have to say, I think everybody agrees with the thought, but in practice, I think we're still seeing more of that than we would really like to, in part due simply to the timing pressure. We do not have enough time. I mean, NGOs have cut most of the personnel they needed to cut within the first 90 days after the announcement of the US funding cuts. That was not enough time to really think about what do I think my organization should be in the future. It was much more about who is being paid by the US, who can I replace, and letting people go extremely quickly. So I would say to some extent the damage is already done to our ability to think about what tomorrow looks like. That is the issue. Is if you have let go of specific, let's say, you've got a department that got gutted, rebuilding it is going to be very difficult. Secondly, I mean, I agree that we always strive for efficiency, but there's going to be a reality, especially when it comes to NGOs, that we have a certain amount of competition. And I think NGOs in the past have found it very difficult to let go of, or rather had a willingness to keep within the organization a certain number of services that has to be theirs, that has to be specific to them. There is definitely a lot of work that could be done on joint services, on trusting each other more. It requires a lot of trust to do that. But I mean, if we're going to talk about something very basic, fleet of vehicles, can we share that? And it's done in very few countries. I've got actually only one example in Lebanon. Big cost saving measure that somehow works, but it should go much further than that. Technical level, data management, data collection. There's a lot of things that we could put into common rather than each of us having our own service. But nobody really wants to do that. And we're facing massive pushback whenever we put that on the table. I would also say that we're letting go of a certain number of activities, as was mentioned. We cannot do everything anymore. The reality is we have been stuffing what we call the humanitarian realm with absolutely everything that we saw that was not being addressed. It's a bit difficult to say today because obviously I'm very sad to see some of the services and some of the response go away, but it's a reality that we've been straining a lot. And of course, a lot of the NGOs like the UN are multi-mandated, so they do not necessarily see a difference between humanitarian and what comes after or what is on the side in terms of development. They see it as a continuity and the need of the people, but there's also the reality of funding streams, right? There is, in that sense, I think almost something healthy in better defining what is the humanitarian realm, but it also means that we're going to have to make a lot more efforts. And here the UN, I would say, are already on it, while the NGOs might be a little bit late to that particular party. There are other actors that need to come in. We've been talking for so long about development stopping in areas of conflict, not being present anymore, not funding, when they are the ones who would bring the response. This needs to stop. Let's be very honest. We need to find ways of ensuring that we can still work on what development wants to call development. I don't care about the terminology, but getting those funding streams to actually work for us. And there are ways of doing it. Community-based development does bring results. It doesn't work for large infrastructure, but it's still a way to work. There are ways, I think, to get those funding streams to work in our environments, and it's going to require a lot of work with those donors to bring them back to the table, to say you cannot just disappear, wait for the conflict to be over, which is the reality today, unless there is somehow some stabilization efforts, and then we start having some issues with humanitarian principles. Those are the few things I can say. I'm going to be very honest with you. We are having discussions with the membership about what the future looks like. And I think a lot of organizations are still stunned. They're still not at the stage where we are, in thinking mode. It has been, 4 months now? We are still under shock. And I think on the NGO side, we are still in that situation where it is very difficult to reorganize and start thinking about what the future really looks like, except, of course, that it's smaller. Okay, we all agree on that. But, how do we rebuild? Where do we go from there? I'll stop there.
Oh, absolutely, Albert. And you can see that even just in this meeting, the attendance today, is lower just because, of the obvious loss in capacity all around the world. Gabriele, over to you.
Thanks, Kelly. I have one question for Ted, one for Albert Philippe. So the question for Ted, you mentioned before, Ted, that indeed there exist two different systems. We have the IASC coordination and then the refugee coordination system. So there are situation settings, so-called mixed settings. I think in your paper, written with Gabriela, you address as well a bit the point of the mixed setting. So I would like to understand, as we have this reality that we have indeed 8 different regional refugee response plan covering more than 50 countries. How do you think in the future, for simplification, we will be able to have a coherent response? You mentioned something in your paper of simplification by stating that all the protection part could be under UNHCR and all the remaining sectors, so the multisectoriality could be under ABC. Can you please elaborate a bit, and whether this is something feasible in a standardized way in a different context, or needs to have a kind of further thinking, remodulation, reflection, etc. So this is the question for you, Ted. And then the question for Albert Philippe is, I read recently, please correct me, Albert, if I am wrong, from ICVA, they mentioned that the Reset proposed to expand the country-based pool fund to manage at least 33% of the global humanitarian funding. So 1/3 of the global humanitarian funding should be allocated to the CBPF, so this country-based pool fund. And this is a big major shift because as of 2024, the part allocated to the CBPF was only around 10%, less than 10%. In some countries like Afghanistan, around 4 or 5%. And then in 2024, the total amount of money allocated for the country-based pool fund was around $1.1 billion. While today, if really this proposal from the Reset becomes a reality, then we are talking about around $6 billion managed by the pool fund. This, of course, is a reallocation. So the question is, who is getting less within this global humanitarian funding? And I would like you to comment whether or not you see opportunities and the risk on this reallocation of money, because of course we know that we want to have more direct funding to the local national actor. We want to have more flexible funding as well. So what is today maybe for development can be as well used for a situation of emergency response, because we need a surge capacity, etc. So, but that's my question to you, Albert Philippe, regarding the risk and the opportunity that you see if this comes through. So this reallocation of the CBPF received 33%, at least 33% of the global humanitarian fund. Thanks.
Kelly, I need to drop out. Can I just quickly answer a couple of points and then say thank you and goodbye? Appreciate it.
Thank you. Yep.
Thanks. And then I actually want to also even come back on the second point from Gabriela, a very important point. So Let me first say there's a question about how we see the cluster reforms happening now, and I basically think it's going to have to happen kind of in some ways. I mean, over time, people are going to make choices, and they are already with the resources that they have. As you know, different country teams are having to quickly make decisions about what to prioritize, what not to prioritize in terms of moving forward. Let me then quickly answer the 2 points from Gabriella, because I think they're important. Look, on the whole issue of mixed settings and where you have a refugee coordination plan, I think HCR has got specific views of how they want to take it forward. They want to organize discussions around the way forward in those settings. And indeed, I mean, they are, pulling people together around these reflections. But I think there's one point we made in our paper, and I think it's an important point, which is we're saying in places like Chad, where you've got the two systems coexisting, we really need to find a way that the RCHC and the overall humanitarian coordination is the overall coordination system. And then what we do for refugees and how they're factored in is specifically pulled together as part of the whole, essentially. And so to respect that clusters can have a role that manifests overall humanitarian needs altogether. But I also want to come to your second question, and I unfortunately won't hear Albert's response. but to say really important point, Gabriele, and look, the ERC has said he wants to set very ambitious targets when it comes to country-based pool fund. And what we have said, Gabriele, is that firstly, we're supportive of the direction of travel of having more funding in country-based pool fund. Right now, it's 5% of the total, as you point out. And we have said in the Grand Bargain Caucus discussions, and actually donors have also said this, if we move from 5 to 15%, that's already a significant increase. So before we get to 33% or any other number, let's get to 15%. And then the other thing we've said is we need to see how it all fits. The commitment to the country-based pool fund, the commitments to the SURF, the commitment to the role of mandated agencies that frankly are one of the main ways that we're going to support systems and reach scale and impact in our humanitarian response, and the commitment to the role of not just local and national actors, but also INGOs in terms of the technical support that they bring, the technical expertise that they bring. It all needs to fit within the overall envelope. And we've actually said OCHA is in a key position to be able to figure out how it all fits. So very much agree with your question. And again, the direction of travel that the ERC wants us to go to is clear, but I think several of the principals have said it all needs to work together. You need several instruments that fit together, and we need to all make it work together, in effect. Kelly, thank you for today, and thanks for the organizers and colleagues. You do really important work. These are not easy times, but we will. I mean, I find it interesting what Albert said. We've had to cut, and in some ways, we've had to cut so drastically that it'll be difficult to readjust because some things are gone. I agree. And at the same time, I think there's still some shifts that can be made. And there's still some adjustments that can be made. So it's not an either or proposition. It's not the way we would have liked to do this or should have done this or should have been forced to do this. But at the same time, we need to continue to see how to become stronger with what we have left. And again, not see humanitarian action as the panacea to every single situation. We need to look at who are the duty bearers and how to have a proportional share of responsibility. Kelly, colleagues, thank you very much and have a good day. Bye-bye.
Well said. Thank you so much. Bye, Ted.
Thank you.
We do have a question in the chat, and I apologize as we've lost two of our speakers, but just highlighting what I think kind of goes back to Altaf's opening statement about localization and the reality of what that area-based coordination could look like. I hope we'll talk about that, the realities of that, not just the ideas of that, but some of the very real challenges to shifting to a better models of area-based coordination. The crux of the question is how much of trust currency do we have with local actors to draw on now? How well empowered, ready and positioned are the local actors for moving this humanitarian agenda forward? Albert, do you have any comments on that?
Not necessarily. I was going to answer. I'm sorry. I was thinking about answering the CBPF question. I think it was addressed to me. That's right.
Sure.
Sorry about that, Kelly. I was keeping this in my head, and I'll come back to you right away.
Absolutely. Yeah. Let's go back to you.
No, this is an important question because we actually first we published a paper very recently, and I think the membership came out quite strongly against this increase in CBPF, and I think it's important to explain where that comes from. So Gabriele, first you were mentioning, so you were asking me first of all, what would be the advantages? Yet, I think the first thing we need to say is that pool funds are generally seen as a good thing. They cut down on some of the unhelpful competition. They allow to have funding that is allocated according to needs and not necessarily some of the political priorities. And it allows for, well, in principle, it allows for a joint decision-making process. Also, the CBPF specifically is and has been very positive for national NGOs for two reasons. First of all, because they can get access to it directly without having to go through a partnership, but also because they're getting the overheads, which is not always the case when they're in partnership with an international NGO. And that matters a lot because without the overheads, you cannot build your capacity. You cannot make your own choices on what you want to strengthen. So those overheads have been absolutely essential to national NGOs. Which also means that, by the way, in our response, we have to be a little bit nuanced because we didn't necessarily get the same amount of pushback between our national and international members. However, the issues we see with this increase in the CBPF are linked to the issues we see with CBPFs in general. First of all, the question of accountability. CBPFs are meant to be run by advisory boards. That is usually not the case in practice. We have advisory boards who tend to have very little actual power. In many cases, national actors are being, thrown into the advisory board with no preparation, no training, no explanation on what they're expecting to do. And in fact, we actually took it over and started training national members on participating in a CBPF. Secondly, there's issues with the flexibility of the funding when they come from those specific pool funds. CBPFs are not flexible at all. And again, when we talk about flexibility, we're really talking about efficiency. We're talking about basically, you walk into a village, you have funding for food security. People in the village tell you, well, actually, what we really need is water. Can you go back to the donor, renegotiate if you have the capacity, and just provide people with what they actually need? CBPF, no. Generally speaking, not at all. And it's natural because OCHA is not a donor. The people they will hire for CBPS will be first and foremost good financial managers. They will be compliance managers. They're not donors in the usual sense. And I think we tend to forget that what we lost with BHA is not just a lot of money. We also lost a donor that in many contexts was actually great to work with. They would actually give us this flexibility. You could go back to them, discuss, reorganize, rework your projects. The one last thing I will say that we really do not like with CBPFs comes back to what I was saying about the issue of trust. CBPFs put a lot of power in the hands of OCHA and DHC, and we do not feel that the power dynamics today would make us want this to happen. And it's very telling that, so the increase of 30% was the initial proposal of the ERC, but Dennis Brown paper on empowering DHC pushes this to 50%. And under the headline of empowering the leadership, it is about making funding available to DHC in order to better direct the response. This is something we strongly disagree with. I very strongly agree with Ted and Alta when they say, for us, it's about empowering the leadership as a whole, the HCT. It's about DHC as a coordinator, not as a figure of authority. So where do we stand? Well, we do think that first of all, pool funds are needed because donors are asking for it. We don't have a choice. There are a number of donors right now who are cutting their funding, and they're saying, if you still want the amount that gets at the end of the line to be the same, you need to cut our internal costs. So that means that we don't manage country by country. We can throw it into a pool fund, and then we might be able to maintain some of the envelopes. But CBPF is probably not for us the best solution, we think. By the way, I noticed in the question, so this the diligence process, absolutely. CBPFs can be massively difficult to access for national NGOs. Once you're in, you're in. That's fantastic. In some countries, great efforts have been made. In the DRC, Susanna, the DHC, worked very hard to include national NGOs. But again, CBPFs are not necessarily built to handle a large number of applicants. So there's almost a willingness to make it difficult and say, well, let's work with a small pool of people because that's easier to deal with. So yeah, alternative pool funds, we need to find them. We have a few examples. There's a great pool fund run by FCDO in Syria that is actually working quite well and is adapting, is changing according to what the NGO feedback is. We have a great NGO-run pool fund regionally in Dakar. It's run by DRC, but it's actually run in a truly consultative manner. We have better examples than what we have with the CBPF. That's where we stand. It's a bit blunt, but again.
You're absolutely right on the spot, Albert, and we appreciate that. Does anyone else have questions as we wrap up this session or comments? Okay, well, thank you guys for your participation, and especially thank you to our speakers. But yeah, I hope we can encourage and to have and continue to have conversations like this that are open and honest about the realities, reflecting the realities on the ground, first and foremost, the people that we serve. Or probably Gabriele, I think over to you, or I can introduce, I guess I could toggle to James for the next session.